Hi, we are Edinburgh Molecular Imaging. Who are we? We're a group of clinicians, biologists and chemists working in a multidisciplinary fashion to deliver really new strategies for people with devastating illnesses in hospital initially. What do we make? We make small optical light switches or chemicals that we deliver to patients, primarily on intensive care, who currently have a mortality of 70%, cost £10,000 a night on a ventilator. What we're delivering is a portfolio of optical switches that will tell us what they have within 30 seconds. Here's our first probe. It's called NAP. It will tell us whether someone's got infection or pure inflammation. It's gone through toxicology. We're going to the clinical phase. What other solutions are there out there? Currently, there are none. The market currently in clinical practice, X-rays tell us very little. You can't take patients to scanners, they're too sick. So this is an approach to bedside imaging with immediate results. Cost of the product to make, about 13 pence per dose. Cost will sell it out, probably about £500 a dose to healthcare providers. The patient groups, initially with our first product, we're going for patients on critical care. They're patients who've been knocked over by cars, have had massive operations, are very, very sick. Worldwide, or even on our intensive cares in the United Kingdom, 40% of all patients are on breathing machines. And currently there are no specific therapies for people who get any of these illnesses. And what we're developing really are these agents that can tell us what they have, but also, most importantly, telling us whether druggable targets are active. So we're making targets that we know drugs will work against, see if the process is there, and then we can switch them off. The other patient groups we're working towards are cancer and also infections, so people who've got nasty hospital-acquired infections like MRSA, etc. For the patients that we want to guide this therapy for, the biggest problem we have is a diagnostic dilemma. Currently there aren't specific, accurate tools for us to diagnose what's happening in people's chests, and this is a way to overcome those barriers. So we're at a stage with funding with this work that it's been funded primarily by the Medical Research Council, the Wellcome Trust, who are charitable governmental funding bodies, to do all of the graft for us to generate the intellectual property portfolio that we have now generated. What we need now really is investment to help us commercialise, to seek active market entry in different settings in the USA and also further afield from Europe, and to develop potentially more products which would be wholly owned by the company. Currently, clearly the IP is residing within the university. What healthcare providers really want are cost-effective solutions that are far superior than current practice. What we offer at the moment is a solution that is cheaper than the current practice and unequivocally better. If you're interested in either us or the products, contact BioQuarter at Edinburgh.